Hi, and good morning, and welcome to today's webinar on Medicare fraud prevention. My name is Rob Faubion. I'm with Age of Central Texas. We're a regional nonprofit organization that serves older adults and family caregivers right here in the Central Texas area. Today, we are very proud to be partnering with the City of Buda and the Task Force on Aging to bring you this very important topic. We know that we are in the middle of open enrollment right now for Medicare, and so we wanted to talk this morning about fraud prevention. Before we get started with the presentation, just a couple of housekeeping issues. Number one, we are recording this session, so if for any reason you need to leave a little early today, don't worry, we're going to be posting this on the Age of Central Texas YouTube channel, so you'll be able to go back and watch the whole presentation or share it with any family or friends that you think might be interested in this information. There's also a chat feature here on Zoom. It's right down here at the bottom of your screen. It looks like a thought bubble that you would see in the comic strips. We want you to click on that, and during today's presentation, if you have any questions, be sure and type those in, because at the end of the presentation, we're going to answer all of your questions. So if anything is a little confusing, or if you have a specific question or comment, be sure and put those in the chat so that we can address those at the end of today's session. This morning, we're very proud to have Angel Hanzik with us today. She is with the Texas Senior Medicare Fraud Program, and they are based out of Houston. And so we're so excited that she's going to be with us today. We're going to talk about how do you prevent, detect, and report Medicare fraud. As I mentioned, we're in the middle of open enrollment that's going to run through December 7th. So this is the time when you have the opportunity to examine your Medicare coverage and make any changes that you want for the new year. That also means that you're going to be getting a lot of phone calls from people who want to sell you the latest and greatest of all the Medicare. And unfortunately, not all of those people are going to be reputable. So we want to make sure that you don't get yourself in a bind by giving out your information to someone who might be a little nefarious in how they use that. So Angel, I am going to turn it over to you for today's presentation.
All right, awesome. Thank you so much for that introduction, Rob. I really appreciate it, and I'm so excited to be here and speak to all of you. Thank you so much to the City of Buda and to Age of Central Texas. This is absolutely wonderful. Like Rob said, I am Angel Hanzik. I'm with the Texas Senior Medicare Patrol. So we are based here in Houston, but we do cover the entire state of Texas. And I'm going to be speaking to you today about preventing, detecting, and reporting Medicare fraud. So let's jump right into it. Let me get my presentation up for all of y'all. All right. Is everything good?
Looks great.
All right. Beautiful. Like Rob said, please put any questions that you have in the chat. Me and Rob will both be watching the chat, and there's going to be a few participation points. And so please feel free to use the chat to answer any questions that I'm asking as well. So today we are going over prevention, detection, and reporting. So what is the Texas Senior Medicare Patrol? So we are a federally funded program, and there's one of us in every single state. And so we are Texas specific, but no matter what state you're in, there is a Senior Medicare Patrol there, as well as the US territories. What we do is we recruit and we train volunteers and professionals about Medicare fraud and abuse. So something like we're doing today. And then we also are a reporting agency. So we report intentional fraud and abuse to Medicare fraud control units through a hotline that we have. So our mission here at the Texas Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So that's a big mouthful to say that we go out into the community and talk about Medicare fraud. So today we're going to be going over what Medicare fraud actually is. We're going to learn some ways to identify the difference between fraud, error, and abuse. We're also going to talk about some current scams that we're seeing. And also we're going to give you the skills needed to prevent, detect, and report fraud. So what is the impact of Medicare fraud? So every year, Medicare is losing billions of dollars to fraud, error, and abuse. And now is a time I would like you to use the chat, and I want you to just throw out a number. How many billions of dollars do you think that Medicare is losing every year? Just any number off the top of your head. I have my chat pulled up so I can see. 10 billion. Okay, any other guesses? It's actually higher. It's higher than 10 billion. Okay, it is $60 billion. That is how much money is being lost annually to fraud, error, and abuse. So that is a huge chunk of change. And there's also approximately 250,000 Medicare beneficiaries who have had their medical identity compromised through having their Medicare number stolen or misused. So you might be thinking, why is this important to me? Why do I care about this? And so Medicare fraud, error, and abuse actually affects every single person. Medicare is funded by taxpayers. And so that $60 billion is actually coming out of taxpayer pockets. It also places the Medicare trust fund at risk. And so with $60 billion being taken out of the system every year, it makes it super unstable. And so you might not be on Medicare now, but maybe in 5 years, or you want your kids to benefit from the system or your grandkids. Well, the hard truth is with so much money leaving the system, it might not be around with so much money being lost. And so that's why everybody should care about Medicare fraud. But of course, the people who are affected the most are Medicare beneficiaries. So with this money being lost, it raises premiums. You're paying more out of pocket, and there's less money in the system for benefits that you need, as well as it's affecting the quality of treatment. It's lower treatment for higher costs. And so here are a few consequences of Medicare fraud, error, and abuse. First, of course, we have medical identity theft. So this is whenever you have your Medicare number stolen and someone is actually representing themselves as you by using that number and receiving services and benefits in your name. There's also a negative health impact that can come from this. So if someone is receiving services in your name, receiving those benefits, you might not be able to use those benefits for yourself if someone is using them. So now you are unable to get the services that you actually need. Or if someone is receiving services in your name, going to the doctor, now there's different data, information under your name. And so if you go to the doctor for an emergency, they may have the wrong blood type or the wrong test results for you. And so it can negatively impact our health. And of course, there's personal financial losses. This is money coming out of our pockets. If someone has stolen your medical identity and claiming these services, the extra costs are falling onto you, not to them, because that's whose Medicare number you are associated with. Okay, now the difference between fraud, error, and abuse. So first we have errors. These are your unintentional mistakes. These are billing errors. We're all human. Perhaps someone put in the wrong code when they were typing, accidentally double charged you. It happens. It's super common. Calling your provider and just checking and ensuring. It can be a super easy fix. Abuse is whenever these errors become repetitive. And so you're unknowingly or unintentionally misrepresenting information to receive payments or services, but it's happening repeatedly. Fraud is the use of misinformation intentionally to obtain these payments or services, and this assumes criminal intent. So I, of course, know that I am not Rob, but if I go and I represent myself as him and receive services, that is assuming criminal intent. Okay, so quick disclaimer, I am from the Texas Senior Medicare Patrol. I am not from Medicare, so I cannot go over benefits with you. I'm not here to sell Medicare to you, but this is just a quick overview of the A, B, C, and D of Medicare. So of course we have our Part A and B. So this is our original Medicare. If you are a Medicare beneficiary, it's pretty likely that you're on original Medicare. About 70% of Medicare beneficiaries are part of original Medicare. And this also, there's the option for Medicare supplement insurance or Medigap to cover any holes that there may be in that in your insurance coverage. There's also Part C, which is Medicare Advantage. So these are private insurance companies that offer the same benefits that Medicare offers, just through those private insurance companies. And then we also have Part D, which is prescription drugs. So this is helping cover those prescription drug costs. And so already this is a lot of information. There's so many different plans out there. And so it can be super confusing to figure out what is correct for you. It's a very complex system, which is exactly why scammers target Medicare, unfortunately. They're able to sit down and really study and learn the intricate systems of it and then manipulate it. So a Medicare number is worth at least $30,000 to a scammer. So this is how much money that they can actually get from using someone else's Medicare number to receive payments and services. But of course, we're not receiving $30,000 from our own Medicare numbers, right? And so it's super valuable to scammers. And so here is some technology that scammers are using right now to actually manipulate people and try and get their information. So first we have dialers, which is actually just a system where it calls out number after number after number without them even having to lift a finger. And once someone actually answers the phone, that software registers your voice and sends it to a real scammer for them to speak with you. Phone banks, this is just like a regular call center. It's a full group of people sitting down and just calling people and maybe even using dialers. So it's very, very efficient. There's also robocalls. So if you've ever answered the phone and it's a computer voice talking to you, that's a robocall. These also have softwares to recognize human voice, and they register your number as a live active number. This is someone who's going to answer the phone. And so they are actually able to transfer you to a real scammer. You may also notice that like after you get one scam call, you answer the phone and then suddenly you're getting 10, 20, 30 scam calls in a day or a week. It's because whenever they register your voice and they realize that this is a live active line, they actually sell your number to other scammers. So even if they don't get information off of you, they're still making money from you, unfortunately. There's also spoofing, which is having your number appear as something else whenever you're calling. So they can manipulate that caller ID, have it look like, if I'm calling from Houston, I can actually have it look like it's a Buda area code whenever I'm calling. So they're able to manipulate things like that. We're actually going to go over that more in just a second. There's also malware. So this is viruses that can get on any of your devices, your computer, your phone, your iPad. So if you ever get maybe a text message or an email that has a link in it or something to download onto your device, and it's from an unknown number or from an email address that you don't recognize, we highly recommend do not click it, do not download anything onto your device because this malware, this virus can get onto your device and it actually tracks your keystrokes, it's tracking where you're going, and that's how they're getting information from you. And of course, there's also social media. As new social media platforms come up, there's new scams that are going on. So Facebook is very popular for a lot of scams. Once again, a lot of people will maybe get their social media hacked, and then they'll have them post links on there or send you messages asking you to download something or to share some information with them. You might just get friend request from someone you went to high school with, and it's actually a scammer posing as someone else trying to get your information. So please be wary of social media. Don't trust just a face and a name on a screen. So a little bit more on spoofing. So this is whenever Medicare calls you. So they're actually able to use the software to manipulate the caller ID. And so it may even say that Medicare is calling you on your phone. But the hard fact is that Medicare does not have the time or the money or the resources to be calling every single Medicare beneficiary. They are never going to call you. So anytime that you're getting a call and it says Medicare, or you answer it and it's someone claiming to be Medicare, this is very likely a scam. This is fraud. They are misrepresenting themselves as Medicare. Just hang up. Don't even answer the phone. Medicare, the only way that they are going to contact you is through snail mail. They'll only send you mail, or now they are doing emails. It's very, very recent. They just started sending out emails, I want to say 2 or 3 months ago. And so these are the only ways that Medicare is going to contact you. Also, they try to do home visits claiming to be Medicare. This is also a scam. Medicare is not going to come to your home. If they're not going to call your phone, they're not going to come to your home. So please be wary of this. Just hang up and shut your door. Do not interact with these people. Okay, did you know that all of this information here is public record? Your criminal records, your property ownership, any vehicles you own, if you've been married, your phone number, your emails, all of this can be found on Google, all on just a simple internet search. So this is to say that just because you're not on the internet, just because you're not sharing your information, it doesn't mean that it's not out there. And so if someone calls you or sends you an email or shows up at your house and they have your personal information, that doesn't necessarily mean that they can be trusted, because all of this information is public record. Anyone can find this information just by going online. So please be wary of that. Do not be very trusting just because someone knows your full name and what car you drive. All right. We've all gotten the calls probably about extending your car's limited warranty. And so it's very similar to that. They're able to just look it up online. Okay, so now a quick overview of Medicare numbers and cards. So all Medicare beneficiaries are issued a Medicare card and number upon enrollment, and this number is super valuable to identity thieves, just as valuable as a credit card, or even just as valuable as your Social Security card. So here's a cross comparison of identity theft. So we're all probably familiar with Social Security, just regular identity theft. So what happens whenever you get your Social Security number stolen, people can file for unemployment in your name. They can take out loans and open up credit cards, and they can even file taxes in your name. And so we all know the threats of this, right? And so we want to keep our Social Security number super safe and secure. We keep it at home. We don't take our card out with us and keep it in our wallet. So we should be doing something super similar with our Medicare card as well. We should be keeping that number secured, because having your Medicare number stolen is medical identity theft. And so people can put false claims in your name. They're able to misrepresent themselves as you at the doctor's office. You can see signs of this. Perhaps you're receiving supplies that you never ordered, such as durable medical equipment, diabetic strips. And you'll start seeing fraud, error, and abuse on your Medicare summary notices. And so that's why it's super important to be looking at our Medicare summary notices every 3 months whenever they come out, and reviewing it, ensuring that all those services are actual services that you received. Okay, so now we're going to be going over some of the common Medicare scams that we've been seeing in Texas in the last year or so. So first, of course, is Medicare card scams. And so this can happen whenever someone calls or visit you and they ask you to confirm your Medicare number so that they can send you a new card. Maybe yours expired. And so they just need you to confirm it really quick. No, absolutely not. If Medicare needs to send you a new card, they know your number. They don't need you to confirm it for them. Or it's very common for people to use threats. They threaten to cancel your health benefits if you don't share your Medicare number. They may say that your benefits are expiring, they have to renew it right now, and so you have to, or else you won't have health insurance for the rest of the year. This is false. Medicare is not going to threaten you or take away your health benefits. Also, they may ask you, is your card paper or plastic? Would you like a new plastic card? Go ahead and just confirm your Medicare number for me, and I can send over a new plastic card. It's great. No, unfortunately, Medicare only has the paper cards, and they are not planning on coming out with any sort of hard plastic cards. And so this is very common. People don't like the paper cards. And so it's a very easily deceiving scam because they want something that's more durable than the paper. But no, anytime that someone is asking if you would like a plastic card, this is also a scam. We're also seeing a lot of genetic testing fraud. And so these genetic tests, people are offering tests to see if you are genetically predisposed for cardiac disease, for any sort of diabetes, perhaps cancer. And so they're saying that Medicare is going to cover it. Don't worry, just go ahead and swab your cheeks, send it in, and we'll let you know. Well, unfortunately, a lot of the times these tests are going to be thrown in the trash and Medicare is going to be charged. And there's actually only 3% of Medicare beneficiaries who are eligible to have genetic testing covered by Medicare. And so 3% is a super small number. So please only take a genetic test if it was recommended by your doctor. Okay, these genetic tests to see if you're genetically predisposed to any sort of diseases. Only do it if it is recommended by your doctor. It seems like a really great idea, but really what's going to happen is it's going to be thrown in the trash and it's going to be money in their pocket. We're also seeing a lot of durable medical equipment fraud. And so we really want to urge you to only order equipment if your doctor has assessed you and confirms that you need this durable medical equipment. Don't sign a blank form for your healthcare provider or any equipment supplier. If they say, oh, don't worry, we'll fill it in for you, just sign it at the bottom, put your Medicare number in. Absolutely not. Make sure you know what you are signing and fill it out yourself or be there with someone while they fill it out. And also be reviewing your Medicare summary notices or your explanation of benefits and ensuring that any equipment on there is equipment that you actually ordered and actually received. We're also seeing home health scams. Unfortunately, home health care fraud is very common. And so this can happen whenever Medicare is being charged for perhaps services that you were given whenever you didn't actually meet Medicare's definition of homebound. And so Medicare won't actually cover these services. And so to meet that definition, you have to be fully homebound, not able to leave at all, not even to run to church or to the grocery store. And so if there's someone offering these services saying, don't worry, Medicare will cover it, even if you leave sometimes, unfortunately, no, this is fraud. Also, if you're receiving services that were not deemed medically necessary by your doctor in your home health care, or if you're receiving services, or if you're being charged for services that were not actually provided. So be sure that you're checking your MSNs, your Medicare summary notices. Ambulance fraud. This one is also very common right now. So this can happen whenever you're being charged for an ambulance, whenever an ambulance was not actually medically necessary, if you could have been using a wheelchair van or another vehicle that could have transported you safely if it wasn't a dire situation, or if you're being billed for more miles than you actually traveled. So if you're only 5 miles from the hospital and they are charging you for 50 miles, that's a bit suspicious. Also, if you are billing a ride in a taxi or a wheelchair van as emergency transport. There was a case a few years ago where a woman was going to the community center twice a week in a wheelchair van, and she was actually being charged to her Medicare as a twice a week ambulance ride. It was being charged as going in an ambulance to the community center. So that's just something to be wary of as well. Hospice fraud. This one is also super unfortunate. Please be sure that your doctor has fully assessed your condition and has certified that you are terminally ill and expected to live 6 months or less if the disease runs its normal course. If you are not certified to be terminally ill, Medicare does not cover the hospice stay or the hospice care. Anytime that a hospice organization is offering very extravagant gifts or maybe cash rewards or anything that is too good to be true, please be wary and please do your research. And be checking your MSNs and ensuring that everything that you are receiving, the care that is being billed, you're actually receiving. As Rob mentioned earlier, we are in the middle of open enrollment right now, so it is a very hot time for scams. So please be informed about what agents and brokers are actually able to do during this period as far as advertising. I want you to know that they are not allowed to cold call you or solicit you. You have to give explicit permission for them to call you, to use your number, to show up at your house. They are not able to do that. Okay, they're not able to cold call you. You need full written explicit permission. Also, please be wary about anyone advertising any sort of special deals or discounts on any plans, anything that's urging you to act fast or urgently. It should be something that's taken with a lot of caution because you have the full open enrollment period to enroll in the plan that you decide. And so anything that is pressuring you, saying you only have today or tomorrow, no, you have the full time up until I believe it's December 7th. And so please take your time, look over any sort of deals. Unfortunately, there are some agents who are signing people up for plans that don't even exist. So make sure you're sitting down with a trusted individual and looking over this. Nursing home scams. So once again, make sure you're looking at your Medicare summary notice for services that may not have been deemed medically necessary by your doctor, or services that were charged but never provided to you, or if you're being charged for more expensive services than what you were actually provided. We had a case where someone was going into a nursing home and going and doing free pedicures for everybody. So go in, clipping their toenails, painting their nails. All they needed was their Medicare number. They were actually charging that free pedicure as diabetic foot care for everyone in the nursing home. So that is a lot of money in their pockets, a lot of money being defrauded from Medicare. So please be wary and be checking those Medicare summary notices. That is what I urge you the most. And so that is just a few of the scams that we're seeing right now. Of course, scammers are evolving, they are learning, they are changing with the times. If there's any sort of big event going on, of course, there's going to be scams about it. So right now we're in open enrollment period. So there's a lot of open enrollment scams. Whenever there was COVID, whenever COVID was first really big, there was a lot of scams about COVID tests, about COVID vaccines. And so please be wary about that. Just take your time, please review things. Don't share your information over the phone. Any personal, financial, medical information, don't share it. Anyone who is calling you, please, if it's an unknown number, don't answer it. If they're important, they will leave a voicemail and you can get back to them in just a bit, okay? And so that's just something to be super, be suspicious is what I encourage you to do. And so how does the Senior Medicare Patrol actually combat fraud, error, and abuse? So we encourage you to protect yourself from fraud using these three: prevention, detection, and reporting. So first, of course, is prevention. The easiest way to deal with Medicare fraud is to prevent it from happening in the first place. So with prevent, we're asking that you treat your Medicare card like you would treat your credit card. Okay, don't share it with just anyone. Don't pass it around. Don't share that number with anyone. Don't give it out to anyone except for your doctor or other trusted Medicare provider. And don't carry your Medicare card unless you know that you'll need it. Leave it at home in a safe place, just like you would do with your Social Security card. Also, please know that Medicare is never going to call you or visit you to try and sell you anything. Like I said, the only way they're going to contact you is either through mail or email now. Please be cautious of offers of free medical services. Nothing in this life is free, unfortunately. Someone is always paying for it. Either it be you, Medicare, someone is paying for it. Watch out for identity theft. Use any skills that you have or any practices that you use to protect your identity to also protect your medical identity, okay? And then also pass this information on. We, of course, don't want to be victims of Medicare fraud, and we don't want our friends or family to either. So we want to disseminate this information and do a blanket prevention. So next we have detect. So first, I want to encourage you to review your Medicare summary notice, your explanation of benefits, your other statements for any services that you did not receive, any sort of double billing, seeing if you're charged twice on there for services, or any services that were not actually ordered by your doctor. So be reviewing those every 3 months whenever they come out. A lot of people see it and it says this is not a bill on the top of it. And so unfortunately, a lot of people just throw it away. If you did throw it away, or if you don't like looking at your mail, if it gets overwhelming or if it gets lost, you can access this information at medicare.gov. You can log in and you can actually see your Medicare summary notice online. And so that's a super awesome resource. Please be doing this. And then we also here at the Texas Senior Medicare Patrol offer a personal health care journal. I'll be sending some up to Rob, and we can also mail them out to anywhere to be distributed to people. But what they are is they are just a wallet-sized journal where you can write down what happens at your healthcare appointments so that you have your own personal record of what happened. 3 months is kind of a long span of time to remember if you're going to the doctor a lot, if you're having a lot of tests done, to know what is going on and to remember that far back. And so you're able to use it as your own personal cross-reference with your Medicare summary notice to ensure that what is on there is what has actually happened and the providers that you actually saw. So if anyone is interested in those, please let me know. I can mail them out to anywhere in Texas. And now the third step. So now we have done all we can to prevent, and we have looked at our Medicare summary notice and we've noticed something weird. What are we going to do? So we're going to report it. So first, call your provider. It may just be a simple error. It might be a billing error. We're all humans, and see if they're able to clear that up for you. Start gathering this information and that documentation, any hospital bills you might have, your Medicare summary notice, any sort of relevant information. And if you need further support, call the Texas Senior Medicare Patrol. We are a reporting agency, and so if you call us and walk us through it, we are able to actually send that case to the correct facility, because it's not just Medicare that handles Medicare fraud. Okay, it is a crime, and so it can be sent to law enforcement, the Office of Inspector General, the Attorney General's office. It depends on the size of the case. And so please call us and contact us. We also have direct contacts at Medicare, and so we are able to send your case over to them so that you don't have to wait on hold with Medicare for however long. I don't know if anyone's tried to contact Medicare before, but it can get a little lengthy. So please use us as a resource. This is a totally free and confidential service. And now if you've been paying attention, this should set off red flags. Free service. We are federally funded. And so if you've ever paid taxes, you have paid for this service. And so that is where that is coming from. Also, please feel free to contact me. Like I said, my name is Angel Hanzik. I'm the outreach specialist here. This is my office line and my email. And then also we have our hotline number. And then if you have any questions, you can call me up and I'll be happy to answer them, or get scheduled for any speeches or trainings that you, your friends, your family, your community might be interested in. And that is all that I have for you today. Thank y'all so much for participating and for listening to me today. It is absolutely wonderful to be here.
And Angel, we thank you very much for all of this valuable information. That we know that there are a lot of people who are dealing with the scams right now. One that we have seen recently is an IRS scam, that they contact you claiming to be from the IRS, and they need to get your Medicare number so that they can clear up something that happened. No, that's a lie. That's when you hang up on these people. Because
Yes.
as you noted, Medicare is never going to call you. They don't have the time to do that. So Another thing that we want to remind folks is you'll see all of the commercials on TV telling you, oh, get this new Medicare plan, and you get all of these bells and whistles that come with it. I'm Joe Namath, trust me. Well, here's the deal. Texas is not part of the national Medicare plan. Texas has its own Medicare. So that means all of those plans that you see on TV don't exist in Texas. Now, you'll call that number, and the person on the other end, whose job is to sell you a plan, whether you need it or not, is going to convince you that, oh, this is just fine. You can have this. No, no, no. You need to talk to someone in your area who can help you, because your Medicare plan is dependent on your zip code in Texas. And so you need to make sure that you are talking to someone who is local, who knows the plans that are available for you, and is not going to try to sell you something just because they need to make that sale. And that's what happens with these commercials you see on television. I have recently spoken with someone who worked in one of those call centers for a while. And she says, our job, if we get a live body on the other end, is to keep them on the phone until we sell them a plan, whether they need it or not. So please don't fall for that, because you're going to find out the first time you go to the doctor with your new plan that your doctor does not take that plan. And you are going to be in a panic to get back on the plan that you had that your doctor accepts. So don't put yourself through that kind of trauma. I love the idea of reminding us to review our Medicare summary notices, because that is so important. I sit down and do that with my parents, because, you know, as we get older, we're going to be seeing the doctor a whole lot more than we want to. And so we're going to be making those journeys to the doctor on a very regular basis. And if you're like most of us, we have 3 or 4 doctors. And so it's not just one who's going to be putting all that information into our summary plan. So it's important to sit down and look it over and just make sure the information is correct. Because as you noted, you know, Medicare is our tax money. We've paid for this. And if someone is taking money out of our pockets, then that is a crime against every one of us. And it means that we're going to have less and less benefits coming our way in the coming years, because, you know, that pot of money is not infinite. It's going to start running low at some point. And if we're losing $60 billion a year out of that pot of money, then that's going to be a problem come sooner than later. So being able to review our benefits and make sure that someone's not taking advantage of us. And like you said, it may be a very simple mistake. It might be something very easy that's, you know, call up your provider and say, hey, this is wrong. Oh, we coded it wrong. I'm so sorry. We'll fix that. That happens all the time. As you mentioned, you know, we're dealing with human beings, and human beings make mistakes. And so most of the time it's things that are easy to fix, but you need to keep a close eye on that, because you want to make sure that someone has not taken your information and is using it nefariously. One last thing I want to let you know about is the Area Agency on Aging, who is a great partner for all of us. They have benefits counselors that can help you right now during open enrollment. The Area Agency on Aging is also paid for by your taxes. It is actually the pass-through funds from the Older Americans Act. So every major city has an Area Agency on Aging that serves it. Here in the Central Texas area, it's the Area Agency on Aging of the Capital Area. You can easily go online and just search Area Agency on Aging and your zip code, and it'll tell you which one serves you. You can call them up and they can help you for free, because again, you've paid for this, help you for free with any of your Medicare questions during the open enrollment period. They can help you walk through what you might need in the new year if your health has changed or your benefit needs have changed. They can help you figure out which one of those supplements you need. You know, maybe now we've been diagnosed with early onset of diabetes, and so we need a different supplement that's going to pay for those diabetic concerns that we have. So they can help you through that. Because they are not an insurance company, And because they have no dog in the hunt, they're not trying to sell you anything, they can be a really good third party that can help you look at it very objectively. And so they're there to help you. So great resources that you have to help you here. Angel, I want to thank you so much for sharing your time this morning with us and sharing all this great information. And again, if you have concerns that you think that you might be a victim of Medicare fraud, you can call the hotline. Again, that number is 888-341-6187. Because it's a federally funded program, they're going to help you for free. So don't think you have to go this alone. You've got lots of folks here that are willing to help you out. If you think that you've been scammed, if you think that you have a mistake on your Medicare report and you're not sure what to do with it, give them a call. They will help you out for free. Again, that number is 888-341-6187. Angel, have I forgotten anything this morning?
No, absolutely not. I think you covered it all. And we did have a question asking, is this recording going to be available for them to share?
Yes, it will. It will be posted on the Age of Central Texas YouTube channel. You can just go to youtube.com, search for Age of Central Texas, and it will take you to our channel, and it will be there for you to share with anybody else who might need that information. So we thank you so much for joining us this morning. We know that it takes time out of your day to come and get this information. So we're so grateful that you joined us. Want to remind you, as I always do, that as older adults, as family caregivers, as those who are aging, as we all are, that we want you to know that there is never, ever any shame in asking for help. That's why all of our organizations that we share with you are here. That's why we exist. We're here to help you in the event you ever need us. So you can contact Age of Central Texas. You can contact the Texas Medicare Fraud Program. You can contact the Area Agencies on Aging. All of us are here to help you and make sure that your journey in aging is successful. So we thank you for joining us. We hope that you have a wonderful holiday season, and let us know if we can ever be of service to you. Angel, thank you very much for being with us this morning, sharing your information. Thank you at home for joining us, and we hope that you have a wonderful rest of your day. Bye-bye.